And we are here with Paintsville Mayor Bill Mike Runyon, Johnson County Judge Executive Mark Mckenzie, and we have a few guests here, a couple guests from the Johnson County Health Department. Julie Bush and Gina Porter are here with us as well today, and we're talking a little bit about the coronavirus and the concerns. Of course, there's been a lot of concerns, Judge. You have a lot of people who I think have absolutely panicked when maybe a panic is not really necessary right now.
And that's kind of why we wanted to do this segment, was to one, be able to share with the community that that community leaders and community organizations and partners have been meeting over the last couple of weeks to discuss the situation, to try to keep everybody in the loop, everybody informed as much as we possibly can. And the health department obviously is our public health agency that's is the key partner in this whole discussion, and so we felt it would be advantageous for them to be here to share information specifically for them, and the mayor can comment on on how important this is for us.
Well, it's important because we don't want people to get into a panic mode, and that's the reason these two young ladies are here with us today, to try to explain to you exactly what the coronavirus is, and the fact that we are working as a community to make sure that we hold this thing down if we have to, and we'll just go forward from there.
I'm glad they're here, first of all, because we have a lot of questions that you hear so much going around, people talking, you see a lot online, and it's one thing you got to kind of do is sort out what is factual, and we're going to get some facts today from some people who actually work in the health field. So we'll turn it over to Julie and Gina here from the Johnson County Health Department. Where do you think we should really begin?
I don't know. I think our thoughts were, we kind of start with, first of all, prevention, I guess, awareness, that type thing, and then what to do, if someone suspects that maybe they have come in contact or are showing symptoms, I guess maybe.
Who is most at risk also.
Right,
yeah.
yes.
Mm-hmm. Well, the coronavirus is, we're calling it the 2019 novel coronavirus because it is new. Coronaviruses themselves are not new, but this is a new strain is what we understand. And the way that you prevent it is similar to flu protocol. Wash your hands often, avoid contact with people who are sick, avoid touching your eyes, nose, or mouth with unwashed hands. So we're also talking about social distancing, stay 6 feet away from people. Things like that. So it's just standard precautions, general good hand hygiene will prevent the spread of it. There is currently no vaccine for the coronavirus, but the best way to prevent getting ill is to avoid exposure.
Just like with a lot of other illnesses, it's a good practice in the first place,
Yes.
And then as far as if anyone thinks, I think a lot of people, if the first thing happens with them right now, they think they have the coronavirus.
Yes.
What are some of the symptoms of the coronavirus?
Well, the symptoms are similar. What we're seeing is fever, cough, shortness of breath. So it's similar symptoms to other issues, and chances are it's another health condition. It's probably not coronavirus, but it kind of shows up the same way.
Right. So I think that's another reason for a lot of the panic. It's just because to the general public out there, there's a lot about the coronavirus that is just unknown,
right.
And it's something that we're not familiar with. We haven't heard about until all of a sudden, and then it's spreading. It rises that concern among the public,
Right, and it is spread through contact with other people. It was originally travel connected to China, but now it's person to person. So it is spread through droplets in the air when you're close to someone who's infected and they cough or sneeze, and those droplets land on you. Close contact such as shaking hands or touching another person that the virus is on. Do you have anything to add to that?
Yes, you also want to be mindful to stay away from high traffic surfaces, areas, and in your home be sure to disinfect and clean and maintain proper hygiene in your home for your countertops. Also things like your cell phone, that needs to be disinfected and cleaned regularly.
That's something we don't always think about, but it's one of the things that a lot of folks, that's probably one of the items that they touch more than anything.
Yes, it is, and it is very surprisingly extremely dirty most of the time. So keeping those areas and places like that clean is very important.
You know, I mean, I think we as people, we tend to think about things that everyone else touches. If we're lifting the handle on the gas pump or you know, a door, that cell phone though. Yeah, that's something that we touch and don't think our hands are dirty now, like you do at other surfaces. But you're right. That probably carries a lot of germs on a cell phone. So things like that. It's just like we were saying. It's a good practice anyway.
Right.
You know,
right. It's things that we hope that people were doing anyway.
Right.
You may want to ramp that up, wash your hands, but do it more often than you normally would.
Yeah.
Cover your cough, cover your sneeze, that kind of thing. It's things that public health has been talking about for a long time. We would just like for you to increase that a little bit now.
I'm going to get right to it because, I mean, you hear on the news a lot about the number of deaths due to the coronavirus. And from what I understand, if someone contracts the coronavirus, it's certainly not a death sentence, and I think we need to put that out there.
It is certainly not a death sentence. It's my understanding that if you are normally in good health and you even contract the virus, you may not even know you have it. You may be asymptomatic. You may not show symptoms.
Yeah.
If you do, it may be mild. We have seen everything from mild to severe to death. Chances are, if you fall into that age category of adult, healthy adult, you're probably not going to die from it. Chances are there is a population, if you're immune compromised, if you're elderly, there may be complications.
Right.
So,
Yeah.
but it is definitely not a death sentence.
I think
no.
that has so many people concerned,
Yes.
though, right now. You know, I mean, but statistically speaking, I'd say this is just me guessing based on things I've heard. You guys are here with us, but it's a small percentage of all these cases that have resulted in death.
It is, and I do have some numbers that I can
Okay.
just throw out at you. I just pulled this off the CDC website today. I'm sorry, not the CDC website, the Kentucky Department for Public Health website. It says that the U.S. reported a total of 938 cases in 29 deaths in 39 states. And of those cases to date, there have been 75 person-to-person transmissions in the U.S., 92 were travel-related, and there are 771 persons under investigation. If you look at just Kentucky only has 8 people that have tested positive. And the governor has been doing those live Facebook streams. Those are in Fayette, Harrison, and Jefferson counties. 54 people in Kentucky have been tested, 46 are negative. We have 8 positives. And the department just keeps putting out, when I say the department, I mean the Kentucky Department for Public Health. They just keep trying to impress on people, wash your hands, wash them often. Those things that we've already talked about, social distancing, stay at home if you're sick. So it's not, if we could say anything to the public, it would be, please don't panic.
Right.
Just be prepared.
Yeah.
We could very well have cases in Johnson County.
Right.
I don't know that. We may not. That's something we don't know. But we should at least be prepared, not panicked.
Well, you talk about, you know, there's been 54 people tested in the state.
In the entire state.
There's
That
a
was
lot
as
more
of,
people than 54 in the state.
Yes.
These are just how many have been
Yes,
tested.
yes.
So there very well could be more cases. We know of, you said, was it 8 or 9 confirmed cases?
8. There are 8 confirmed positives.
So it could be, and probably, in my opinion, likely is going around in other cases, you know, and that's just something that, just like you said, we've got to be prepared for.
Yes.
So.
Our 60 and over population and those with either heart disease, diabetes, or lung disease are the ones that really we should watch out for. And those are the groups that need to practice the social distancing most of all. Avoid large crowds. Send family and friends to go get your groceries, things like that. And those are also the ones that should be ready and be prepared most of all and have supplies on hand.
Yeah.
There was actually an order today from the state where medications can be filled for an extra 30 days from the medical provider. So to help prepare. Other items is to stock up on essential food items, over-the-counter medications, supplies such as toilet paper, and other items that you're going to, waste items that you're going to use on a regular basis in order for your household to be prepared if you either do need to practice social distancing or do become ill. then you can stay at home and isolate yourself.
If you were quarantined
Yes.
to your home, do you have the supplies you
Exactly.
need?
Correct.
Right. So, and that kind of, I guess, explains some of these other shortages, just like you were talking about the toilet paper. There's been panic on the shelves about the toilet paper and all that, and it's it's really been concerning for the rest of us. Though we're trying to stock up in case there's a shortage, and it's kind of snowballed from there. But it does make sense when you look at it that way. Why it goes back to that's something that households are going to need. So.
Right.
Any other numbers, any other things you want to put out there while we're here?
Just a couple of real quick. If you do feel like that you have either been exposed or have been in contact with someone that has been exposed or has tested positive, you want to be sure that you contact your medical provider before you go to the emergency room or your local doctor, so that you can be screened to see if you should be tested. Going straight on into the emergency room is not advisable at this time. You don't want to infect other possible sick patients. So make sure you call before you go. That we cannot stress that enough. Also, there is a hotline number for the state. If you have questions, are concerned, or even just nervous about the situation, you can contact 1-800-722-5725. And that is through the Kentucky Department of Public Health. That is a hotline for the public. And there's also a website that has information. It's KYCOVID19 Kentucky COVID-19.ky.gov. And you can find information there.
A lot more information, I imagine. And then also, I guess a question is, can people be screened right here in Johnson County, or how does that work?
Yes, they can be screened.
Yeah, I mean, I guess we don't want everybody in the county lined up to be screened
Right.
tomorrow, though. But I just didn't know if it was here or if they would have to go to Frankfurt or wherever.
No, you can get screened here in Johnson County. But we again do stress that you call. Cold, allergy season is early apparently this year, so the flowers are blooming.
My nose is running. Yeah, it was sunny and 70 on Monday and raining on Tuesday. So
It is Kentucky.
yeah.
Yes. So there are many things that it could be instead of the coronavirus. So it's important to call before you go. But yes, the testing capabilities are available. We do have local commercial labs that are doing testing, which will expedite the process a little bit more. But it still takes a little bit of time. So we don't want to tax our providers with people just coming in without being screened first.
Yeah. So the bottom line is, though, wash your hands, keep everything clean, avoid the crowds, and what else? You have all the numbers there, all the facts.
One more thing that I would just say to add to what Gina said is the commissioner for the Department for Public Health, Dr. Stack, has put out some information when to seek care. So we would like for people to stick to these guidelines if they can.
Okay.
And it says, if you are worried well, please stay home. If you are well and you are just worried, please stay home. Going to the hospital or the doctor's office just adds a higher concentration of people and overwhelms the medical staff. Please stay home if you are well. Instead of going to the doctor's office, I would say. Like Gina said, if you are ill, but you would not have sought care if it weren't for COVID-19, but you are worried, please do not seek care at an ER, doctor's office, or a hospital. Please call before you go. Call the hospital, call the doctor's office before you go. But we would also say that if you are ill, if you feel like you have an emergency, because there are emergencies that are not COVID-19. If you break your leg, please go to the ER, or
That's what the ER is for.
If you are
right.
in a car accident, please go to the ER. That's what they're for. We don't want anybody to not seek care because of that. So we want you to seek medical care. We just want you to be prepared and take the steps to ensure that if you are sick, you are not infecting other people.
Sure.
In a crowded emergency room.
So, But yeah, we just want to make sure everyone is well prepared, but not panicked.
Yes.
That's the bottom line, right?
Also,
Anything
one
that
more.
you'd like to add?
Yeah.
One more thing is if you have not received your flu vaccine, you still should and
Okay.
can. They are still available. You may contact the local health department or your local provider. That will also help in possibly limiting the testing in other areas. So if you have flu vaccine, that may prevent you from getting the flu and also be able to narrow down results if it is COVID-19. So.
Well, Judge Mayor, anything else? Any questions you have need to be
Yeah.
answered?
I would just like to say, girls, since I'm the only one in the room over 60, thank you very much.
You feel a lot more comfortable now that we've done this.
I feel good.
But we do appreciate the health department, all the work they do, and all the community partners that have had conversations about this, because it's the education piece is important as anything else
Absolutely.
at this point. And we're also in conversations with other organizations that the county and the city are work with, Senior Citizen Center, the Regional Detention Center,
Also, your school system.
and school systems. They've been over and met with the health department at the courthouse the other day, and so all the organizations in the community, there's constant communication right now just to try to keep that preparedness level at the highest it can be. So we appreciate you having us out.
No problem. Appreciate
Yeah, thank
all you guys. Again, that was Julie Bush and Gina Porter with the Johnson County Health Department, also Paintsville Mayor Bill Runyon and Johnson County Judge Executive Mark Mckenzie.